welcome to Beyond the Mirror podcast. I'm Dr. Olha, and today with me I have a fantastic guest, a good friend, and a doctor with who we have been working for probably nearly 8 years.
Yeah.
Dr. Nick Sinden. Dr. Nick has a GP background and fully specializing in medical aesthetics, has a very successful clinic in Leeds, Elevate Aesthetics, and he's also a clinical lead and trainer for cosmetic courses. So we're working together there. Nick, can you please tell us, how did you start in medical aesthetics?
Well, thank you for that lovely introduction, Ola. That was lovely. I started in medical aesthetics it was 2014, so just over 10 years ago. And at that time, I was a very new GP. And I just thought, I want to do something completely different to my day job, but still using the skills of general practice. So it was actually my cousin who said to me before I went to medical school, she said, when you're a doctor, you can do my Botox. And I thought, I've got no idea what that is. And that was many, many years ago. And that was always in the back of my mind. And I thought, yeah, why don't we try that? And I did a course and I absolutely loved it. And my passion for aesthetics has grown since 2014.
And obviously you have a very successful career now, and aesthetic medicine have changed dramatically. So a lot of people who are starting now probably have much better choices for their education and support and mentoring. How did you do it? How did you find it? Did you do a day course? Who supported you? Who helped you? Who guided you?
Yeah. There's a very easy answer to that, Ola, and that's no one. No one. I chose a course based purely on location. I'm in Leeds, so I chose a course in Manchester, and I did a 2-day course. 1 day focused on botulinum toxin, 1 day filler, and after that, I literally just went out and practiced. And I think that was the best thing that I could have done, because I think, leaving it after the course, your confidence just decreases. So I think practice was key for me to succeed.
How was this feeling? Do you still remember when you treated your first patient?
Absolutely, and it's something I tell my foundation delegates when I'm teaching. After the course, it was about a month after the course that I did my first Botox treatment, and I didn't sleep for 2 weeks. I was convinced I'd given this poor lady a brow droop or an eyelid droop, but it was absolutely fine. But it's just that confidence that you don't have right at the beginning. But everything was fine.
Well, that is very sweet. I'm sure you have a better sleep now when you treat your patients.
I was texting her every day to make sure she was fine.
She's probably was thinking what's going on with this doctor.
Indeed, she was.
And Nick, you are almost full-time in medical aesthetics now. Yeah. You're still doing a GP work, but it's a purely private.
Yeah.
How did you find taking this first step and leaving security of NHS, security of your pension? How was this working for you?
It is scary. I'll admit it. It is scary. The transition from full-time general practice into aesthetics was over a few years. So I dropped my full-time general practice job, picked up my 1 to 2 days a week at Bupa, working as a private GP, which I still do because I thoroughly enjoy it. But it was a gradual kind of transition into full-time aesthetics to build up the clinic. And I probably, when I first started, was working 20 to 25 hours a week in aesthetics, even as a full-time GP. So it's having that time to actually, build that business whilst phasing out of the NHS. But it's a very scary thing to do.
Do you miss NHS?
No.
It took you a while to answer.
I miss doing a lot of general practice and medicine. It's why I became a GP. It's why I went into medical school, was to help people. But the pressures on doctors in the NHS, I don't miss.
Do you believe that in medical aesthetics we're also helping patients, but just in a different way?
Absolutely. Every day we both help patients, changing things that have bothered them for years. Something as easy just as I saw a young girl recently. She was an actress, and she was very conscious that when she smiled, she showed a bit too much gum, and just a little bit of botulinum toxin changed that for her, and that made a massive difference to her and her career. So I think we do help people on a daily basis.
It is very rewarding.
It is.
I always believe, and that is the visions that I share, is that we may not save lives, but we definitely change lives
them
for the better.
Absolutely.
What your family and friends thought when you decided to take a risk and start your medical aesthetic business? Were they supportive? Did they doubt you?
I think because I did it over a period of time, that transition, it wasn't that I woke up one day and said, right, bye NHS, I'm gonna work for myself. That they saw me build up this, successful business, and they could see that, I'm a person who doesn't take a lot of risk with financially, those kind of things. So they knew that anything I did, I was certain that I was going to make it succeed. So they were very supportive, very supportive.
You said that at the beginning you were working about 20-25 hours a week in aesthetics and still was managing full-time job as a GP. So how many hours in total you were working? And I believe we also need to count the hours that we put behind the business, how actually to grow the business outside of delivering the service.
Yeah.
So how many hours have you been working?
So as a full-time GP, I worked 4 days a week. So that's 4 full days. And my early aesthetics working pattern was I would do aesthetics on a Thursday, a Saturday, and a Sunday.
So you were working 7 days?
I worked 7 days a week. And I often finished my general practice clinic at maybe 5, 6 o'clock, and I went straight into my evening clinic during the week as well.
So now 10 years down the line, you are in business. How many hours do you work?
7 days a week, Ola.
Oh, have you not think to improve that?
No, I don't do 7 days a week every week. Now I incorporate my Bupa work, and obviously I love Elevate. It's everything I've ever wanted from a clinic. I have a fantastic business partner who works with me. I have they're both fantastic therapists that we have. It's a pleasure to go to work every morning, and that's what I love. And if that means I do a Sunday clinic so I can see people that can't see me during the week, then I will do that because I love it.
Well, I suppose the work is no longer a work for you. It's just a part of your life, and you just truly enjoy it. And I think that is very rewarding because a lot of people hate to get up in the morning to go to work, but they need to do it. It's not that they do it because they want it. And I think that is a big achievement, that you found something that you truly passion and love.
I wake up in the morning and I never think, I don't want to get up today.
Oh, that is very inspiring. I would say I share the same feelings for aesthetics too.
I absolutely love it.
Satisfying.
Absolutely love it.
Nick, you said that you learned a lot kind of yourself and you attended courses, that you didn't have mentor as such, but do you relate or can call a person who played some role in your career? Maybe someone who have been a role model, or maybe you saw this person and you said, wow, I just want to learn that. I want to improve my skills. I want to become like them or better.
Yeah, I think excuse me, although I didn't have a mentor, there was one lady who was there at the early part of my career, and she was She was a lady who I actually did a course with through cosmetic courses when I first started, and she worked up in Leeds, and I just felt we had a connection. And if there was any little question I had, I would send her a little message, and she'd answer it. And that I was extremely grateful for, because working in aesthetics is very isolated. We work as independent practitioners, and I think just having that person there, just who you can just ask a question to, if there's something you're not certain about, is actually very helpful. Although not a formal mentorship scheme, I got a little bit of help.
I think that is very important, but also sometimes I think in aesthetic in particular, because we started around the same time, now it's becoming much better. But 10 years ago, there was very few practitioners that you can ask and expect that they will give you an answer or help. Yeah. Sometimes people want to keep things to themselves. Absolutely. And I think the fact that it's so developed now, we practice, I would say, more and more evidence-based treatment. So we're happy to share more information. We can read journals. There is a lot of groups. I think it's very important to rely on someone and know that at least someone can reassure you that you have done the right thing.
Absolutely. Absolutely.
Nick, what is your favorite treatment?
To have or to perform?
To perform. Well, you can share with us. You can share with us both. Let's start with performance. Perform.
Do you know what, Ola? I just love doing a Botox treatment. I absolutely love it. I love seeing the result. It's a very rewarding treatment to do, and to see that result just 2 weeks later and how it just refreshes the face. I absolutely still love a Botox treatment. My passion is full face rejuvenation with fillers and toxin, and those are treatments that I've done now for 10 years and absolutely still love doing it every single time.
So you said, Botox, that is your favorite treatment to have, to perform.
To perform.
And what's your favorite treatment to have?
To have. My favorite treatment to have, in clinic, we have the Aqua hydrofacial treatment. And if I need to relax, I will definitely pester my therapist to have one of those.
Oh, fantastic.
It gives me chance to relax, and you end up with glowing skin afterwards. So it's all good.
Would you like to guess what's my favorite?
Your favorite treatment to have?
Well, let's just guess both. So let's just start with to have.
To have, I would say, I think you like a facial as well. I think you like a facial.
You're very right, Nick.
Yes.
I think skin rejuvenating treatment, facials, microneedling, chemical peels are absolutely my favorite. Yes. And to perform?
To perform, I would say full face rejuvenation fillers.
Absolutely right, Nick. You know me.
I know you very well.
You know me very well. Medical aesthetic has been growing and growing. What do you think, Nick? Is there an end in sight of growing in medical aesthetic, or there is no end in the sight of that?
I think the popularity of aesthetics just gets more and more popular. I think we're seeing a change to very, very natural treatments. I'm seeing a lot of patients who are coming to me saying, I don't want people to know that I've had anything done. And that could be using the other modalities that we now have. I think aesthetics is very, very at the forefront of technology. We're seeing regenerative medicine in polynucleotides. We're seeing fractional microneedling with things like Morpheus 8. These treatments are very, very natural treatments. And I think their popularity is only ever going to get more.
Oh, absolutely. I agree with you. But also I think with natural result, you can achieve a natural result with other options.
Absolutely.
It's very much dependent on technique, product, and practitioner.
Absolutely.
What would be your recommendation, especially to those practitioners who are starting an aesthetic? What is the best way to attract new patients and build up your practice?
Yeah. So this is one of the most difficult things to do.
Yeah.
And I think the key to building your patient base is talking to people. I think it's talking to people, it's getting to know people in your area, other local businesses, maybe people like hairdressers that may come in for treatments, talk to them, and then they can advertise your services for you. That's one way. We all do it, social media. Social media wasn't really a thing 10 years ago when I started. And now it's something that we all have to do to attract those patients. And they'll see you. And I think being visible on social media is key for your patients because they instantly form that relationship with you before they arrive. So if they know you before they turn up, then they are going to love you.
And what is your opinion on different sorts of marketing and advertisement? Have you had any experience? Would you share some insights? What have been working for you? What has not been so successful?
Yeah, I think advertising and marketing is an absolute minefield. I think it's an absolute mine. You could spend thousands of pounds on advertising and marketing. I think things to avoid. My key tip to anyone out there who's looking for advertising or looking to advertise is don't ever advertise people that come to you. So if you have somebody ring you and say, we've got these screens for you to advertise on, then I would never do that now. I've done that in the past and literally got nothing from it. I think you have to, as a business and as the director of your business, you have to plan your marketing to areas where you know your patients are going to be. So that might be, we recently got a phone call from someone asking us to advertise in a small little brochure that had plumbers and, TV aerial extensions and fitters. That's not the kind of publication that our patients will look, or maybe they'll look at it, but they wouldn't choose their aesthetic practitioner from that. So it's choosing your advertising wisely and in areas where you know your patients are going to be, your ideal patient.
What is your thoughts on asking your patients to recommend you, maybe reward them in a way for recommendation?
Yeah.
Is it something that you think is effective, working?
Yeah. We as a clinic, we offer a complimentary facial treatment for anyone who refers a patient and they have a treatment. Mm-hmm. So I think that kind of loyalty scheme is absolutely paramount to make people feel rewarded for coming to see us. We want to make them feel good, so we'll offer them a complimentary facial.
Fantastic. And I believe it's difficult to get people through the door, as you said, but it is even more difficult to make sure that these people stay. Otherwise, you constantly would need a new stream of patients.
Yep.
Any tips on how you can retain your patients?
Yep. Communication. Communicate with your patients regularly. Your patients come to see you, they like you, so they want you to contact them. So I have a very comprehensive follow-up and aftercare program that we offer in clinic. So my patients will receive messages from me. They will also receive phone calls from me, checking that everything after their treatment was absolutely fine. Then they will come back and see me for a review as well.
And do you do this personally? You said that patients receive calls from you and messages from you, or do you have your assistant, receptionist who does this?
It's me.
Oh, wow, Nick.
It's me. So it's not an automated system. All of my patients will receive a message from me after treatments, and they will also receive the Google review link that they can then go ahead and do a Google review after their treatment. So that's my personal communication. It's been like that since day one. I'm a bit of a control freak, so I like to have that control with contacting my patients.
We have very similar protocols in our clinic, but our admin team getting in touch with patient usually, and I'm always happy to be in touch with patient, but they manage appointment and follow up and check that everything's fine. But that is why you're probably working
That's why I work 7 days a week.
7 days a week.
That's why I work 7 days a week.
So Nick, what will be your recommendation then to the patient who are looking to have cosmetic treatment? These days, Instagram is absolutely full of medical aesthetic practitioners, estheticians, facial yoga instructors, medical aesthetic practitioners, plastic surgeons, and I think sometimes information very confusing.
Yeah.
And as a patient who don't have a knowledge on the treatment, you could look at different experts and realize they advise completely different things. So what is important factor and how they can make sure that they staying safe?
Yeah. I think the first thing would be, if you're considering a treatment, maybe have a chat with your friends and just to see if they've been to anyone that they can recommend. I think that would be a good starting point. When you're looking through social media, look for medical practitioners. So there's a great term out there, advanced aesthetic practitioner, and that often means somebody who's not medical.
Yeah.
So it's delving beneath the surface of those titles and asking them, are you medical? What's your experience? What products do you use? I get asked all the time what products I use, and I'm more than happy to tell people. Where's the clinic? Where's the location that you'll be visiting? Is it just a backstreet address, or is it a nice clinic? Those kind of things. Google reviews. Look for Google reviews, see how many they've got, see what other people say about that practitioner.
And how people can make sure that the practitioner that treating them is medical, because sometimes we know, unfortunately, there are people out there who are not honest, not always provide all the information and can mislead. Is there any checks that patient can do?
So if your practitioner says they are a doctor, a dentist, or a nurse, you can go on their respective governing body website, the GMC, GDC, NMC websites, and they have registers of practitioners. So you can type in their surname and see if they're actually on that register.
Well, I think that is a very, very good advice. And there is some communities like Safe Face,
Yes.
I think British College of Aesthetic Medicine, that they only list medical aesthetic practitioners. So that's also helpful. But I would agree with you. Personal recommendations are probably the best in this field.
Absolutely.
Nick, we agreed that aesthetic treatment can change people's life. But do you personally believe that it's not just about reflection in the mirror, that people come to us and it's not necessarily only about the look? What is your opinion on that?
Absolutely. That is something that we see in pretty much every patient that comes to us at Elevate. And that's why we chose the name Elevate. Elevate your look, elevate your beauty, elevate your confidence. So we want to work beneath the skin, beyond the mirror, and really change people's lives.
That is a very powerful message. I like that. Nick, would you be able to share with us, obviously without talking about names and personal details, but will you be able to share some cases where you think that result has been life-changing for your patients?
Well, I mentioned the young actress that I saw with the gummy smile. So obviously that's life-changing for her. A very small treatment for myself, very big impact for her. One lady that comes to mind was a lady who had a facelift, and she was probably late 40s. She had a facelift, and her result was not as good as she'd hoped for. And she was getting married. And she came to see me just to see if I could do something to make her feel better walking down the aisle. And the result we achieved using fillers and toxin was far better than the facelift that she had had. And it was a reaction that will always stay with me. As I passed her the mirror, she cried. And that will always stay with me, because that was such an amazing impact for her.
Absolutely amazing. And I think these moments make such a great satisfaction in your professional life, in your career. Just this week, I have had a conversation with my patient, absolutely lovely lady, and she said, you know, the job that you do is so important and rewarding, she said, because you're changing people's life every day.
Yeah.
And I thought, wow, and it came completely from the patient, without us even having a conversation beyond the mirror. She said there are so many jobs out there that they make no difference in people's life.
Yeah.
And your job is so powerful.
It is.
And I think that is a very important, but I also think, unfortunately, not everyone sees that, or some people, there is a lot of maybe not so ethical practitioners who unfortunately take advantage from people who have their insecurities as well.
Talking about someone who had insecurities, I saw a lady for a consultation. And before any consultation, I perform, a pre-appointment form goes out, and I saw this lady had filled it in, and it was clear she had mental health problems. There was OCD, body dysmorphia, personality disorder, those kind of things. And she came to see me because her concern was just her folds. And I had a good chat with her, and she'd seen other people. And I said to her, I don't think this is the best thing for you. And we had a really, really heartfelt chat about it. And she said, thank you. That's exactly what I wanted to hear. And I've been to other people that have just wanted to do the treatment.
Well, fantastic. So it's also, I think, important message. We don't treat every single patient.
We don't treat every patient
who's coming to clinic.
Absolutely.
And very often during consultation, we find out that the treatment that patient might thought right for them is actually not an option.
Exactly.
So often we will come up with some different proposition, different treatment plans. Consultation is definitely a key.
Absolutely.
Nick, you have a successful career, a very successful clinic, but what is the most memorable moment of your career so far?
The most memorable
achievement
moment. It has to be Elevate. It has to be. My prior to Elevate, I was, renting rooms in different places in Leeds and Sheffield, and in 2021 it came together and we formed Elevate, and that has to be the most memorable and most accomplished achievement I've done to date.
Well, we will be looking forward to celebrate the 10th year anniversary.
I cannot wait. I cannot wait.
Which should be big.
It will be big. It will be big.
And as a reflection on your career, Nick, what would you wish you have learned earlier in your medical aesthetic career?
What do I wish I'd learned earlier? I think to have some faith in myself, have some faith in what I was doing, that people like the treatments. I think it's quite difficult, again, when you work alone, to really gauge how that person feels about the treatments that you performed. There's no one beside you saying, "Oh, that's really good," and I think that is difficult. But I think to have some faith in your own abilities, and to take that leap from the security of the NHS into private medicine, maybe a bit earlier.
I agree with you, Nick, and I personally believe that you're never too early or too late. You just on your own time, and things happened to you at the right time.
Yeah.
Personally, I think I always impatient. I wished everything have happened already, but when you reflect, you realize that there is a reason why things happening with this amount of time. So I think you just need to learn to be patient and enjoy the journey.
That's it. And as I tell people, it's the best thing I did for my career 10 years ago. And I absolutely love it.
And where people can find more information about you, Nick, especially those medical professionals probably who might want to learn from you, might want to have some question, want to connect with you, as well as patient. So where they can look for the information.
So I run training courses through cosmetic courses. So contacting cosmetic courses. Patients or anybody who wants to look at the clinic can look at elevatemedicalasthetics.co.uk. We're on Instagram and as Elevate Medical Aesthetics. And that's how people can get a hold of me.
And you have your personal Instagram as well.
And my personal Instagram, Dr. Nick Sinden. Yes.
Fantastic. Thank you very much, Nick. It has
been a
been
pleasure.
great pleasure.